Hi everyone, Dr. Pierce here. I wanted to create this video to go into greater detail about this situation with thiazide diuretics and how that impacts calcium. I think in my previous attempts at going over this topic, I was combining too many concepts for the purposes of trying to simplify it, but I think in the end of the day, I actually made it more confusing, of which I apologize. So as a result, I'm going to go over in greater detail what the mechanism is regarding calcium and what happens if you inhibit the sodium chloride cotransporter. This is the same image that is from one of the cell types of one of my slides that goes over the cell graphic, if you will, of the distal convoluted tubule from my lecture slides. And I've just expanded it here so I have more room to essentially draw on. Now we know that the function of the NCC is to reabsorb a sodium and a chloride. So we have our sodium and chloride in the tubular lumen, but if we inhibit this process with a thiazide, or in theory, anything that might target this receptor, of which thiazide classes of diuretics would do that, but if you inhibit this receptor, the outcome is that we have less sodium inside the cell that's been brought in, less chloride. I'm going to kind of ignore chloride, even though it is an important solute. For our purposes, I'm going to kind of just pretend it's not existing. And hopefully that oversimplification doesn't make things worse too. But for now, I want to focus on sodium and calcium. So if we have less sodium inside the cellular compartment, that means that normally sodium would get pumped out of the cell using the sodium potassium ATPase in exchange for potassium. But this process is now diminished. And I'm going to kind of put some wavy lines through this because it's diminished because we have less sodium inside the cell to pull from. If we have less sodium inside the cell to pull from, then essentially there is a smaller proportion of sodium ions at this location in the peritubular capillary. This is the peritubular capillary here, running alongside the distal convoluted tubule. So we have less sodium essentially concentration that's been really kind of diminished a little bit because there's just less sodium coming out. Now the sodium potassium ATPase does continue to function. It is the powerhouse of the cell, if you will, so it is working a little bit, but its capacity is really diminished. Okay, now let's talk about the sodium calcium exchanger. Let's look normally at the action of calcium. Everyone seems to be pretty solid on understanding that calcium leaves the tubular lumen using this TRPV5 receptor ion channel. The calcium enters into the cell. Now, what happens to this calcium under normal conditions is the calcium would leave, or sorry, that's supposed to be a C. The calcium would leave across the basolateral membrane using the sodium calcium exchanger. So a calcium gets reabsorbed in exchange for a sodium. Okay, but remember, that's the normal process. Calcium normally gets reabsorbed through TRPV5, and then it gets reabsorbed back into the bloodstream using this NCE. Now let me see if I can erase some of this. All right, so that was normal conditions. Now let's talk about what happens with the calcium under the presence of a thiazide. So remember in our thiazide, we've inhibited sodium from coming in. So as a result, the cellular sodium concentration has decreased, and subsequently there is some decrease in the blood. But I'm going to compare this because there's still quite a bit of sodium just kind of coming in from upstream. So we know that there's got to be a lot of sodium in the blood because, you know, if our blood sodium drops to nothing, I mean, that's not compatible with life. So there is still sodium coming in here, but there's just simply less of it leaving the cell and getting into the bloodstream at this little stretch of the capillary. So I'm going to do a little comparison here. The intracellular concentration of sodium has gone way down. Okay, I'm going to put 3 big arrows because we've lost the function of this NCC. Now, the blood, I'm running out of room here, sodium concentration is down a little bit, but I'm going to put 1 arrow instead of 3 arrows. So it's down a little bit, but it's not quite as bad as inside the cellular compartment. Now let's go back to this sodium-calcium exchanger. The thing that is driving the exchange of sodium for calcium is this transcellular concentration gradient. Usually, there is enough of a difference in the sodium in the blood compared to the sodium inside the cell that a sodium will just fall down its concentration gradient into the cell. Okay? So that's how normally it happens. And every time a sodium falls down its concentration gradient from the blood, which is higher concentration, into the cellular compartment, which is lower concentration, and a calcium gets exchanged and pumped out. But what's going on in the presence of this thiazide is our cellular concentration gradient is way down. I'm going to put like lots and lots of arrows down. And subsequently, that means that the ratio of sodium in the blood to the concentration of sodium inside the cell, if we were to take that ratio, then that means that that ratio is even bigger than normal. And as a result, what sodium is kind of flowing through this area will massively fall down its concentration gradient because there's a big concentration gradient. Imagine instead of going down the slide, from down someone's, like a slide alongside someone's pool in their backyard, compared to going down a slide off the side of a mountain, it's really going to go down. And remember, every time these sodiums get pulled in, because this bigger change in ratio, more calcium gets exchanged for it. And as a result, we start really tugging any and all calcium that's around. I mean, it's going to get massively moved out. And this is why there is a drop in calcium excretion in the presence of a thiazide. And in fact, taking advantage of this kind of side effect of thiazides is one of the ways that you can help treat calcium-containing kidney stones. And that's just a fun fact. I'm not testing over anything like that, but a calcium-containing kidney stone, you want to stop kind of jamming more calcium into a stone that maybe it's stuck in somewhere along the kidney nephron or in the ureter or something like that. So they will give a thiazide to try to